Joining me to discuss is Dr. Sylvain Charlebois, professor at Dalhousie University. Sylvain, thank you very much for joining me on Counterpoint.
My pleasure, David.
So for our viewers, can you summarize what some of the findings and recommendations from the CCSA were in regards to alcohol?
Well, so a few years back, they issued guidelines, and these guidelines are somewhat embraced by Health Canada. Guidelines suggested that Canadians could drink up to 15 drinks a week, depending of who you are, your gender, whatnot, without really endangering your health. Now, every now and then, the center will go back to the literature and revise it and see what else we've discovered recently. And so they did that. They actually reviewed over 5,000 different studies on alcohol consumption around the world. And now they're presenting new guidelines, but these guidelines are a complete contrast to what we have already right now. And so they're inviting Canadians until you have until September 23rd to actually comment and react to guidelines. And as you mentioned earlier, David, these guidelines are pretty strict. Beyond 2 drinks a week, you could potentially endanger your own health, according to the center.
And I mean, what is the justification for the radical shift? Has our understanding of alcohol changed so drastically in that period of time you just described? Are they evaluating evidence in a different way? This feels like such a shift, at least in my view. It's hard to reconcile the disparity between the existing guidelines and what's being proposed now.
Yeah, no, absolutely. I mean, of course, science is not an absolute, so you should appreciate the science and the research, and I think it's an important thing to update the research and understand exactly what the risks are, because risk will change every single day. But you're right. I think there's the guidelines that are being presented are really different. I mean, you basically see potentially a huge shift when it comes to alcoholic consumption in the country. If people are compelled to follow these guidelines, it would be a huge shift in Canadian life, because, as you know, Canadians do drink more than a couple of drinks a week on average. In fact, if you look at the consumption of alcoholic beverages per capita in Canada, Canada ranks about 40th in the world. So we're not top consumers, but we're not at the bottom half either. So we tend to enjoy different beverages depending of what you're doing.
Mm-hmm.
It's because it's part of the Canadian life.
Yeah, and that's my follow-up question for you. Is this so far divorced from the ordinary Canadian's experience with alcohol? I know that something like 80% of alcohol consumers in Canada drink within the low-risk guidelines that currently exist. Is this so far to the extreme that you feel it would maybe be ignored by folks who indulge in information like this?
It just seems as though that this particular guideline is driven by Biden agenda and many biases against alcoholic beverages. It is a center which advocates for the reduction of consumption of alcohol beverages. Let's actually not forget that. And this center is also partially funded by the government as well. So we're not sure exactly what the relationship between Health Canada and this center is. To me, it seems quite odd that this center, which works in the periphery of the government, it seems to be mandated to dictate what guidelines should be, because right now it is consulting the public.